So a 66-year-old man with atrial fibrillation, a number of other problems, parotid gland issues, back pain, he's pretty tall. The question becomes, how do you manage this patient?
Our next patient is also outstage patient. He is 66 years old gentleman. His name is like Mr. MP. So his medical history in the recent years diagnosed with salivary gland stones. And also he mentioned that he have some dental problems and sleep apnea. Patient mentioned that last year he went to the emergency room for back pain, and he had been told that he has abnormal rhythm in the EKG. They repeated, diagnosed as atrial fibrillation. Also, it had been repeated again, the EKG, months later, and it showed the same thing, atrial fibrillation. The patient was prescribed a blood thinner, but he would like to seek another approach to treat is it atrial fibrillation, is it not, and if there is anything can be done to avoid the medication, like the blood thinners. And
so I think it was Pradaxia, they put him on the anticoagulant Pradaxia, and he read the side effect, he was concerned.
Yes.
His story is interesting because his atrial fibrillation, he's in persistent atrial fibrillation, so he wears the watch and, he's always in AFib. He says, the only time I'm not in AFib is when I'm not wearing a watch. Anticoagulation is part of the management for atrial fibrillation. He and his wife, a very charming couple, I enjoyed visiting with them. They walk, they exercise, they got married in their 50s. They both have children from other relationships. They've come together. It's interesting because, she's a breast cancer survivor. And I think he told her, he said, look, we have a 50-year contract, so we've got to do this together. So they went on an aggressive, healthy lifestyle program. They walked 3 to 5 miles a day. One day they walked 24 miles, 12 miles each way. They exercise together. She actually is a vegan chef. I think had a business and makes these beautiful, delicious plant-based meals, and saw some of our videos, made some adjustments in him. So, he has that benefit. So he has a relatively healthy lifestyle. Now, you try to understand, when did the atrial fibrillation start? He doesn't know exactly, but he tells me in 2023, he was looking at some video talking about mindfulness and appreciation. So the video said, put your hand on your heart and appreciate your heart beating. So he put his hand over his heart, couldn't feel his heart beating, so didn't feel a heartbeat. And he still doesn't feel it beating. Now, that's probably due to the atrial fibrillation. And so he probably had it at least that time, maybe before. Now, the other thing, this may be a little controversial, I mentioned, they had the coronavirus vaccine.
Yeah.
And they had 2 boosters, and they still caught the coronavirus infection multiple times after. And we know the vaccine can trigger inflammation. Infection can trigger inflammation. So the atrial fibrillation may be a sequelae of that, because his lifestyle is reasonably healthy. He's a nice, thin person that exercises. So that's one thing to keep in mind in terms of the potential underlying causes. So the question becomes, what do we do now? He's in persistent atrial fibrillation. And the issue with atrial fibrillation, number 1 would be symptoms, rapid heartbeat, shortness of breath, discomfort. He does not have that. Number 2, the risk of stroke. His risk of stroke is kind of borderline. He's 66, so he gets 1 point for being over 65. And he had an echocardiogram that showed an injection fraction of 45%. Kind of in the gray zone. Some people may read normal one day, abnormal the other day. So he had at least 1 point on the CHA2DS2-VASc score, maybe 1.5 or 2 at most. So then maybe that push you toward anticoagulation. The fact that in persistent AFib may push you more in that direction. And then the other third potential problem is chronic atrial fibrillation can progress to heart failure. So abnormal remodeling. An ejection fraction of 45% suggests that there may be some early adverse remodeling. So given those things, no symptom, but possible early adverse remodeling, borderline abnormal CHA2DS2-VASc score, we can lean toward anticoagulating him now. But I would want to work to get him out of atrial fibrillation and keep him out of atrial fibrillation and reverse the abnormal remodeling to maybe help the heart get stronger. So the approach could be multifold. What we like to do, look at micronutrients, look at the gut, see if they're abnormal microbiome, start him on a healthy diet. He's been eating very healthy. It made some changes. We can tweak it a little bit. In 4 weeks, when we get those results back, we'll make a decision as to whether to do a gut cleansing protocol. And then we'll decide whether to start him on an antiarrhythmic drug, amiodarone, and go for a cardioversion to get him out. Now, amiodarone is a medication. If you look it up, there's a lot of side effects. The reason I like using it is probably the best drug for atrial fibrillation. I like to use it for a short period of time to help the heart get under control. So when you cardiovert, you have the heart stay out of atrial fibrillation. That plus the nutritional regimen, if there are micronutrients that need to be replaced, we'll address all those things simultaneously. So that approach will be taken with him. We follow up. We'll make a decision on the amiodarone and other things as well. And so he's got a very interesting clinical scenario because there's some complex things and a number of different options. They were asking about atrial fibrillation ablation. Atrial fibrillation ablation does have its place. In his situation, I'm not certain I want to jump to that immediately. I think there's some other work to be done to look at his systemic biochemistry and physiology and see if we can correct that first. It may be part of the regimen later on, but I think with him, we can probably do this out of it. And then there are other things such as natural kinase, which there's some data suggests it may stabilize the spike protein. So if he received the coronavirus vaccine, he may be reproducing the spike protein, which may be triggering more inflammation. So we went ahead and started him on natural kinase as well as some other anti-inflammatory supplements. So we'll see him by phone, see how he does, and then see where we go. So again, not so straightforward, but the number of options we have, I feel fairly confident we could probably get this condition.
And I think because the patient is not symptomatic, that's why he feel like I may not have anything or may not need like medication because he's not feeling the symptoms that regularly the patient feel, the palpitation and other things.
Yes. And as you pointed out and you discussed with me earlier, his height, there's some other connective tissue issues suggestive. So at some time, you may do a CT of the chest to make sure there's no aortic issue with the consideration of Marfan's syndrome. So we'll keep that in mind too. Great scenario. So again, it's the thought process. It's you want to look at things, go below the surface and understand how the patient is doing from a biochemical standpoint and a physiological standpoint and address those issues. Great case.
Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.